Now that the year 2020 had just started, home health agencies nationwide are still scrambling to know more about the patient-driven groupings model, or PDGM. We here at Note-e-fied will guide you through the 5 major components of PDGM to help you and your business not only survive, but to also thrive in the coming year. Calculating reimbursements. Reimbursements under PDGM heavily rely on the Health Insurance Prospective Payment System, or HIPS code. This 5-character code is used to describe the patient's condition at the start of care. The HIPS code is comprised of the following. The first position is the episode timing and admission source. The second position is the clinical groupings. The third position is the functional level. The fourth position is the comorbidity adjustment. And the last position is a default placeholder, which is the number 1. Agencies may use grouping software to generate the code. Medicare, however, will be assessing the HIPS code in their system for the final claim. It is imperative that proper coding must be observed to avoid irregularities with the billing process. Each HIPS code has a corresponding case mix weight. We multiply this case mix weight to the national standard rate to generate the case mix adjusted payment amount. The case mix adjusted payment amount is to be multiplied to the labor percent, which is 76.1%, to have the labor portion. Next is to calculate for the non-labor portion by multiplying the same case mix adjusted payment amount with the non-labor percentage, which is 23.9%. We now take the labor portion and multiply it with the wage index to have the wage adjusted labor portion. Finally, know the total PDGM payment for the patient's payment period by adding the non-labor portion with the wage adjusted labor portion. Additionally, calculate for the RAP by taking 20% of the total PDGM payment. Take note that reimbursement will heavily rely on the components of the HIPS code. Agencies must pay attention on how they account for their patients' characteristics to generate an accurate code. Educate your medical and billing staff with the billing procedures and have your agencies be PDGM compliant. Note-e-fied will keep you updated with PDGM information. Stay tuned for more videos. Visit us at www.note-e-fied.com or follow us on YouTube, Instagram, and Facebook.